Imagine looking down at your feet right now and noticing something strange. A tinge of color that shouldn't be there. A coolness in your toes, even though the room is warm. A dull ache in your calves that you've been brushing off for months, telling yourself it's nothing, telling yourself it's just getting older. I'm Dr. Elena Marsh, and for the past 22 years I've worked as a vascular surgeon. I've held scalpels over legs that could have been saved. I've looked patients in the eye after procedures and watched something leave their face, not just the limb, but the life they had before. And the hardest part of my job has never been the operating room. The hardest part is knowing that most of what I see on that table was preventable. The damage was building for years. The signs were there. The body was sending signals the whole time, and nobody taught the patient how to read them. What I want to share with you today is not complicated. It doesn't require a prescription. It doesn't require expensive equipment or a gym membership or a referral to a specialist. It requires only your body, a few minutes of your time, and the willingness to push through a level of discomfort that will feel significant in the moment, but will mean nothing compared to the alternative. Because the alternative, the one I watch unfold in hospital corridors more times than I care to count, is a life that shrinks. A world that becomes smaller. Walls that get closer. A wheelchair where independence used to be. Let me tell you about a woman I'll call Dorothy. She came to me after 2 years of what she described as a persistent bruising sensation in her lower legs. She was 70 years old, sharp, independent, proud of the fact that she still drove herself to the grocery store, still tended her garden, still made Sunday dinner for her family every week. She had been to 2 doctors in those 2 years. One told her to take it easy. One told her to wear compression stockings. Neither of them sat down with her and explained what was actually happening inside her blood vessels, what would happen if the process continued unchecked, and what she could do to reverse it. By the time she arrived at my office, the color in her left foot had deepened to a mottled violet. Her skin was cool to the touch below the ankle. She had a small wound on the side of her heel. She said she'd bumped it on a step 3 weeks earlier and it hadn't healed. When I pressed along the pathways where I expected to find a pulse, I found silence. No blood moving. No arterial response. The tissue around the wound had begun to darken at the edges. I admitted her the same afternoon. We operated the following morning. She lost her foot. She recovered, as people do, with remarkable resilience and with a sorrow that settled into her eyes and never fully left. She told me, in the weeks that followed, that she wished someone had explained this to her sooner. Not in medical language, not in a pamphlet filled with diagrams. Just someone speaking plainly, telling her what was happening and what she could do about it. This is me doing that. For you. Right now, your circulatory system is a closed loop. Your heart generates the pressure that sends blood outward through your arteries, down through your trunk, into your hips, your thighs, your calves, all the way to the tips of your toes. That blood is carrying oxygen and nutrients, and every cell in your leg is waiting for that delivery. Once the delivery is made, the blood has to return. It travels back through your veins, fighting gravity the entire way, using a combination of vessel valves and muscle contractions to make the journey back to your heart and lungs, where it gets resupplied and sent out again. When this system works perfectly, you don't think about it. Your legs are warm. Your skin holds its color. You can walk without pain. You recover quickly from small injuries. But when the system begins to fail, when the arteries narrow, when the vein valves weaken, when the muscles that help push blood upward stop being used, the consequences accumulate quietly, steadily, and with very little warning until the problem has become serious. Arterial narrowing happens when plaque deposits build up along the inner walls of your blood vessels. This is not a sudden event. It happens over years, influenced by diet, by inactivity, by inflammation, by blood sugar levels, by smoking. The opening that blood needs to flow through becomes smaller. The pressure behind it remains the same, but less blood gets through. Your muscles and skin and nerves downstream receive less oxygen. They begin to struggle. They begin to signal their distress through color changes, through cooling, through pain when you demand more from them than the limited supply can support. At the same time, the veins are facing their own crisis. The valves inside your veins are one-way doors. They open to let blood move upward toward your heart, then close to prevent it from falling back down. When those valves weaken, blood begins to pool in your lower legs. The pressure in your veins increases. The legs feel heavy, tired, swollen. The skin changes. The tissue sits in a bath of stagnant blood that is low in oxygen and high in waste products, and it slowly deteriorates. And then there is the muscle pump. Your calf muscles are not just for walking. They play a critical role in your circulation. Every time they contract, they squeeze the deep veins running through them and push blood upward. Every time they relax, those veins refill. This pumping action is essential for returning blood from your lower legs to your heart. But if you spend most of your day sitting, if your calf muscles have weakened from disuse, the pump becomes insufficient. Blood stagnates. Pressure builds. The cycle worsens. These three failures, arterial narrowing, venous valve dysfunction, and loss of the muscle pump, combine into something that is more dangerous than any one of them alone. And the result, if nothing intervenes, is tissue death. Ulcers that open and refuse to close. Infections that spread through dead tissue because there is no blood flow to carry immune cells to the site. Tissue that turns black and requires removal. But here is what I want you to hold on to through everything I am about to say. This process can be interrupted. It can be slowed. In many cases, it can be meaningfully reversed. Not by waiting, not by taking it easy, by moving, by using your body in specific ways that target the specific failures happening inside your vessels right now. The first thing your legs need is drainage. Right now, if you have been sitting for any length of time, blood is pooling in your lower legs. It is sitting in your veins, low in oxygen, heavy with metabolic byproducts, pressing against vessel walls that are already under stress. The fastest way to clear that pooled blood is gravity. Lie flat on your back and raise your legs so they are above the level of your heart, straight up against a wall, or elevated on pillows, or resting on the back of a sofa. Your legs should be as close to vertical as you can manage. Hold that position for a full 60 seconds. What happens during that minute is significant. The blood that has been sitting in your veins begins to drain, pulled by gravity back toward your core. Your veins, which are distended and under pressure, begin to empty. A low-pressure zone develops in your lower leg vessels, a kind of vacuum created by the absence of all that pooled blood. When you bring your legs back down, and you should do it deliberately, sitting up and letting them drop, blood rushes in to fill that vacuum. The force of that inrush creates what is called reactive hyperemia. The sudden surge of fresh, oxygenated blood through previously congested vessels creates friction along the vessel walls. That friction stimulates the cells lining your arteries to produce nitric oxide, a molecule that causes blood vessels to relax and widen. Vessels that were narrowed and sluggish become more open. Blood flows more freely. Tissue that was starved receives oxygen. You should feel this. A warmth spreading through your lower legs. A tingling, particularly in the feet and toes. A sense of fullness, of heaviness, shifting quality. That is the sensation of circulation responding. If you feel nothing, if your legs remain cold and unchanged, it is a sign that the process has advanced further and that this movement needs to be done more frequently, twice daily at minimum, to begin retraining your vessels to respond. After the drainage, your veins need active help returning blood to your heart. This is where your calf muscles come in. Sit in a chair with your feet flat on the floor and your knees bent at a right angle. Now lift your heels as high as they will go, squeezing your calf muscles forcefully at the top of the movement. Then lower them back down. That is one repetition. But the goal here is not slow, controlled strength training. The goal is rapid, rhythmic pumping. Think of each heel lift as a stroke of a pump because that is precisely what it is. Each contraction squeezes the deep veins in your calf and drives blood upward. The faster you repeat the movement, the more blood you move per minute. Perform 30 seconds of these rapid heel raises as fast as you can sustain while keeping the movement full and your toes on the floor. Your calves will begin to burn quickly. That burn is the sensation of muscles working at high demand, of vessels being forced open to deliver more blood to working tissue. It is not damage. It is the system waking up. By the end of 30 seconds, your calves should feel hot, possibly trembling, pulsing with a sensation of fullness. Place your hands on them if you need confirmation. The heat you feel under your palms is real, measurable increased circulation happening in real time. The third movement demands more from you. It requires you to stand and to keep moving until it becomes genuinely difficult. This is not casual movement. This is therapeutic exercise built on a principle that vascular medicine has been using in clinical settings for decades. When a muscle is sufficiently deprived of oxygen, when it has been worked hard enough that its demand outstrips the available supply, it releases a protein called vascular endothelial growth factor. This protein travels through the bloodstream and signals the body to grow new blood vessels, not to repair existing ones, to build new ones, tiny new capillaries first. Then over weeks, larger collateral vessels that create alternative pathways around areas where the main arteries have been narrowed or blocked. This process, called angiogenesis, is the body's own bypass surgery, and it is only triggered when the muscle reaches a state of genuine oxygen deprivation. Comfortable movement does not do it. Easy walking does not do it. The threshold has to be crossed. The muscle has to work beyond what the current blood supply can comfortably support. Stand up and begin marching in place. Lift your knees high as your waist if you can manage it. Drive your arms. Use your whole body. This is not a gentle walk. This is a forceful, deliberate march. Keep going for 90 seconds at a minimum, and then keep going past 90 seconds until your legs begin to burn deeply, until the muscles feel heavy and cramped, until you feel that unmistakable ache that tells you your muscles are running out of available oxygen. When you reach that point, push further. 10 more seconds. 20. The discomfort you're feeling in those final moments is precisely the signal the body needs. The oxygen debt you are creating in your muscles is the trigger for new vessel growth. Push through it, then stop. Stand still and breathe. Your legs will tremble. They will feel heavy and hot, and they may cramp slightly. That response is confirmation that you crossed the threshold, that your body received the message, that over the coming days, the process of building new circulation pathways has begun. The fourth movement focuses on the place where circulation fails first and most catastrophically, the toes. The capillaries at the ends of your toes are the smallest blood vessels in your lower legs. Only a single blood cell can pass through some of them at a time. They're the last in line to receive blood, the first to suffer when pressure drops, and the first to close permanently when circulation fails long enough. Gangrene does not begin in the thigh. It begins in the toes. And the muscles that control the toes, small, forgotten, almost never deliberately exercised, are the key to keeping those capillaries open. Sit down and place your feet flat on the floor. Now curl your toes as hard as you can, as though you were trying to grip the floor with them, trying to pick up something small with just your toes. Hold that curl for a full second, squeezing as hard as possible. Then spread your toes wide, extending them as far apart as they will go. Then curl again. Repeat this 40 times, moving through the full curl and full spread on each repetition, with as much force as you can bring to each movement. The small muscles in the arch of your foot and the bases of your toes are contracting and releasing with each repetition. As they contract, they temporarily compress the surrounding capillaries. As they release, those capillaries spring open and blood rushes in. This repeated compression and release keeps the capillary beds active, patent, and supplied. Your toes may cramp during this exercise. They may tingle intensely. They may shift from the cool or pale color you started with toward a warmer, pinker tone. All of those responses are signs that the capillaries are responding, that blood is reaching tissue that has been underfed. If you do these 4 movements, the drainage elevation, the rapid calf pump, the ischemic march, and the toe curls, every morning and every evening, the cumulative effect over 30 days is measurable. Legs that were cold begin to warm. Coloring that was purple or mottled begins to normalize. The cramping that comes with walking begins to occur later over longer distances. Small wounds begin to heal. The risk that has been quietly accumulating begins to reduce. This is not a treatment for advanced disease. If you have wounds that are not healing, if you have areas of skin that have darkened or feel numb, if you have been told by a physician that your circulation is severely compromised, you need medical evaluation alongside these movements, not instead of it. But for the vast majority of people who are noticing the early and middle signs, the cold feet, the aching calves, the heaviness, the color changes, the cramps at night, this protocol is the most powerful non-medical intervention available. 22 years of vascular surgery has taught me one thing above everything else. The patients who do the work, who move when movement is hard, who push when pushing is uncomfortable, who treat their circulation as something worth fighting for. Those are the patients who keep their legs. Dorothy deserved to know this 20 years before she arrived in my office. You know it now. The question is simply what you choose to do with it.